to love yourself, and then you have to think good about yourself. Positive things about yourself, like the way you are doing good or positive things to your friend or the so-called best friend. So that is the very initial stage. Let this be aware, like, wow, it means I don't have relationship with myself.
Greetings, everybody. Welcome back to Personal Leadership Master with Anesu, where we help you to harness your true personal leadership in order for you to realize, step into, and maximize your potential and live an effective life, which allows you to become the best version of yourself. Today, we have a special guest on the show. Her name is Dr. Kissah. Dr. Kissah, welcome to the show.
Thank you so much.
Would you mind just giving a brief introduction of yourself and what you do to our viewers?
Okay, thank you. Professionally, I'm a psychiatrist, and I've been working as a psychiatrist for the past 13 years. And I've worked with various organizations. In the country where I came from, in Tanzania, I worked with the Muhimbili National Hospital, with the Department of Psychiatry. And also I was a honorary lecturer at the Muhimbili University of Health and Allied Sciences. And also I was also part-time lecturer at Herbert Keruki Memorial University. Apart from that, I worked with other organizations like AAR with their wellness services, and I was their psychiatrist consultant there, providing the wellness services in various organizations. And I was also Secretary General of the Mental Health Association of Tanzania. We abbreviate as MEHATA. And through that, I and my colleagues, when we were the team of mental health professionals there in Tanzania, we did quite a job when it comes to mental health advocacy through various commemorations, like let's say during the Mental Health Day, we commemorate depending on the theme that was available by that particular time. But also we did mental health advocacy through schools and through media, including trying to promote mental health in the country now at that time in Tanzania. There was a time I was the vice president in East African Young Psychiatrists Association, which includes the association that includes all the psychiatrists in the Eastern countries, Eastern African countries, including now Kenya, Uganda, and then Tanzania, and also because it was Eastern, then it involved also Rwanda and Burundi in the Southern Sudan. So I was the vice president for a period of 2 years.
I think that the track record speaks for itself. It's really amazing. And I think we're really going to have a quite interesting conversation because I think you are very suitable for today's topic. And I think it's one of the majors that you also focus on when you're helping people in your field. And it is the aspect of self-image. Lately, I've developed an interest, and I think it's been almost 2 months now. I've been studying the subject itself on self-image, and I feel like it's quite relevant for audiences for us to discuss much into it because people tend to underestimate the power of self-image. But maybe before we go that further, would you just give us what you think or what exactly self-image is all about?
Yeah, self-image, as you've said, it's a very broader thing, more than people be aware of. When you talk about self-image, it's go beyond the how do I look? How is my appearance when I look myself in the mirror? Self-image is go deeper into not only the physical appearance, the physical image, but mostly in your mental image about yourself. So it's more of the internal thing rather than external part. The external part is just a minimal, like how do I appear? How do I look like? But more is internal part. How do I think about myself? How do I think about my appearance? How do I think about my intellectual? How do I think about my morals? How do I think about my sexuality? So in totality, all are the dimensions of the self-image, rather than that the one minimal part of the appearance. Yeah.
Self-image, definitely. Maybe somebody might be asking, all right, what's the difference really when we say that somebody has a bad or distorted self-image and somebody has a has a well-formed or positive self-image? What are the major differences between the two? Maybe somebody has a distorted self-image, but they don't know it, that they have that kind of self-image. How best can they tell the difference between a positive self-image and a negative self-image or distorted self-image?
So when you talk about self-image, as I said earlier, it's more of internal rather than
Yeah.
external, and how somebody think about. And as you have just put it, there are two main different types of self-image. One is positive and one is negative. And it's true, one can have a negative kind of self-image without being aware that I have a negative self-image. Or one can have a negative and know that I have a negative self-image, but I don't know what to do. And the other one can have a positive self-image, So as I said earlier, when you look at the self-image, okay, there are some dimensions. So if one has a positive self-image, it means that this one will feel good about the appearance in totality, from the head to the toe. How are my hair, my body, my face, my eyes, anything about my appearance, physical appearance, he or she will be okay with that, accept the way he or she is appeared or look like physically.
Yeah.
The other thing now, there's part of the intellect. I feel like I'm good enough. I'm having a intellectual ability to analyze things. Okay, I can deal with it. I can do some tasks which need the intellectual part of me. I'm okay with it, rather than feeling like the negative one would feel I'm stupid. I cannot do this.
Yeah.
I'm not intelligent enough. I'm not good enough. You understand? So on another dimension, the skill dimension, one will feel like, okay, when it comes to social interaction, I'm okay. I can interact. I don't afraid of meeting new people, forming new relationships, networking. And also when it comes now to that is the social skills, but also there is what we call now another skills like how can I put it? Technical skills. Like I'm good in art, I'm good in cooking, I'm good in doing this, I'm good, they have that in themselves that they can do it. Even if they think that I've never do it, but I'm not scaring to try. You understand? But with a negative self-image, like, no, I cannot be with other people. How will other people feel about me? Maybe I'm not good enough to make a relationship, or all these negativity. I cannot do that. They don't even dare to try or want to learn. They've already told themselves they cannot, and they're not like that. That's negative for their self-image. There's the issue also of moral dimensions. Okay, what are your values as a person? Okay, like, do you value yourself? Do you have any values or principles that you rely into your life? The principle that guide your life, the principle that will tell you this is wrong, this is good, this is what we call those moral dimensions. The one with a positive self-image will have that, and you know how to balance, and the other one, the negative self-image, doesn't have any principles that guide, doesn't feel to have any values, any principle that will guide his life or her life. We just like being just there or carried with usually I used to use this term, like if the floods come, they take him. If it's a wind now, it's what they take him, because it doesn't have his own value, his own principle to rely into to guide his or her life. That is also part of self-image. And the other part is now when it comes to sexual dimension. The one with the positive self-image, usually also they're positive on their sexuality, they're positive on their roles on their sexuality, So those are the part of the self-image, but the opposite can be true, because now if you have a self-image, now the one with a negative image is like the flip-flop of the positive self-image. It's opposite now to negative self-image. So in totality, all those are the components of the self-image and not only just how do I look when I look myself in the mirror.
It's quite interesting how so many people tend to be concerned about. Of course, it's also very important for you to be concerned about how you look outside, your presentability. But I was just amazed by how much people put so much work in making sure that the outside appearance is very good, and they neglect the greater part which contributes to self-image, which is the internal part, or the internal perception of how they see themselves. And I think I also suffered from
That's it.
that a couple of years back. I also struggled with self-image. Well, during that time, I didn't know that it was it was poor self-image that I had, but I also struggled with that. When only to realize, and even when I was digging deeper, that self-image has a lot of limitations on a person, because self-image also determines what exactly is going to be hard, what you're going to find hard for yourself, what you're going to find easy, how far you're going to go in life. All of that is dependent or tied upon self-image. But how is self-image formed?
Okay, what I can say, self-image can be part of your personality.
Okay.
And personality is it's a broader topic of its own,
Yeah.
but personality is characters of yourself, your affection, your coping skills, your functional ability, your social interaction skills. In totality, it's make now you a personality. And the personality can have roots way back since when you are in the womb, during your childhood. How was your childhood? How was your the way you have been raised, the way you've been, yeah, was it more of the critic? Was it more of praise? Was it more of a supportive? Was it of more of good bonding and positive interaction? Was it what? That creates your personality. And that part of the personality is now how you feel about yourself. You understand, which is part now of your body image. I have like, I used to call body image has got like cousins. But it's not really cousins, just for you to understand that
Yes.
there are other like features of an individual which also play bigger role when it comes to self-image. It's like self-esteem,
Yeah.
self-efficacy, self-confidence, self-concept, all these in totality affect your self-image. And especially so when it comes to the self-esteem. Self-esteem and self-image, somehow we can say they have this kind of chicken and egg phenomena. One can start having maybe low self-esteem, feeling about herself, I'm not so good enough, I cannot do this, I'm not like the other one. And this can occur with part of the personality and how this somebody has been raised up and create the personality. And one has been low self-esteem. So if one have low self-esteem, feel like that internally, then that also affects the self-image.
Self-image. Yes.
Or one can start having feeling about my appearance is not good. And because my appearance is not good, then it leads to low self-esteem. I'm not good enough, I cannot do it. And then it leads to low self-confidence, low efficacy, that no, I cannot handle this. Everything will be bad, bad, bad. So self-image can develop depending on, can be contributed to a larger extent to our personality. And our self-esteem and our personality also can be affected from when we are in the womb, how during childhood, during school time, and then how we've been raised up until when we are adults and the personality is full attained or full developed, and one now can portray the image of probably self-esteem. So that's what I can say about the self-image. It's not something that started from nowhere. Usually it has roots way back when you look into history. Someone who has got negative self-image.
Yes. Yes. How about now somebody who has realized that, all right, I have a negative self-image that is in place, which is limiting me so much in my endeavors, in the things that I'm trying to do, and my self-image is quite pretty bad, and it's pulling me back. How then can they try to work on that? How can best can they deconstruct some of maybe the negative belief systems that they have of themselves, or that negative mental perception that they have of themselves? How best can they work on that to now at least try and instill a positive self-image?
Okay. First of all, they have to recognize that they have negative self-image. That is the very, very important thing, to let them be aware of that if they're not aware, and that they have to change and try as much as they can to have now this positive self-image, which is more healthier, or is healthier compared to the negative self-image. So first of all, it's to let them be aware. And now, because they have this core belief in their mentality, in their cognition, that I'm not good enough, cannot do this, everything they think about themselves, it's negative.
Yeah.
I cannot stay in front of people because my appearance is not good, I don't have a nice shape like others. I can, so let them be aware and try to identify what are their core beliefs, which are the negative beliefs, and then starting working into that. But at the same time, as I said, it can be part of their personality. It can be traced way back even since childhood. We need to find out also what happened for this somebody to develop this negative self-image. And after realizing that, now it's time to let this somebody to change now that core belief, which is negative, to the positive side.
Yes.
Starting feeling good about themselves, starting thinking good about themselves. And most of the time, I used to tell some of my patients who have that kind of negative self-image that the most important thing here is like, you don't love yourself. Self-love. You are not a friend of yourself. Because if you're a best friend of yourself, and if you love yourself in your mind, most of the time it will not be there. Because I can ask, who is your best friend? And they can say, so and so is my best friend.
Yeah.
Then I say, okay. And what can you do to your best friend? Then I want to do good things to my best friend, like encourage your best friend, talking good about your best friend, say, wow, you look good, this dress suits you so well, those are the things, or other, it depends on your relation with the best friend. I say, okay, if you can do that to your best friend, you can do that also to yourself. So you have to be also best friend of yourself. You have to love yourself. And then you have to think good about yourself. Positive things about yourself, like the way you are doing good or positive things to your friend or the so-called best friend. So that is the very initial stage. Let this be aware, like, wow, it means I don't have relationship with myself. And that's why I feel then when they realize that and start now thinking positive about themselves, usually it helps to change the picture and starting to be more of positive side, improve their self-esteem and also improve on their body image. So they can start slowly by just, okay, you can just wake up in the morning and just look yourself in the mirror and start talking good things about yourself.
Yeah.
Like for a woman, you can say, and most of the time it's mostly in women, although it's also can occur in a man, but men can be more of the internal part that is really affecting them. But women, they also affected much also on their appearance. So you can just tell yourself, you are beautiful, you are courageous, you can do it. Just tell yourself.
Yeah.
It's very some they can take it as funny, they can laugh when I tell them that, okay, just practice and say, see. And it's create now a good start of the day. It let a person start feeling good about themselves. You understand? So
Yes.
it's a very minor practice, but really helps. And then you can say, okay, in a day, you can find 2 minutes, like think about yourself, positive things about yourself. You understand? Also, that help a lot. And the assignment also, I can give some assignment or say, okay, the other say, okay, and I found that worked with some of my patients who have this low, a negative self-image. Okay, can you list 10 good things about yourself?
Yes.
If you have more, you can list more. Then they list, okay. Can you realize or can you list 10 strengths that you have or the skills that you have? Then they can list. If you have more, you can list more. Okay. Can you list 5 people who helped you in your life and try to think what were the good things they were talking about you or they saw in you? Can you list them in the list? Okay. Can you list 5 people who you helped them with whatever circumstances they have, and how did you do it to them to help them to overcome whatever situation they were in? Then they can list. Okay. So them to realize that they have a lot more than they think.
Yeah.
You understand?
Yes.
And then
Yes.
when they try now to practice that, to try to connect with themselves, to try to think positive about themselves, it really helped. Although others is to go to the extent it became difficult to rectify that, then they need now extensive psychotherapy with a psychologist to help them now to do the cognitive behavioral therapy to change their negative core belief to be more of the positive and help them now to deal with their negative self-image.